Welcome to Deuk Spine Institute. I'm Dr. Deuk, CEO and founder. It's May 23rd, 2024. I'm here with my team. We're getting ready to perform bilateral Deuk laser disc repair for two degenerated herniated discs, L4-5, L5-S1. We'll be doing a piriformis release on the right side later, which will be a separate stream. Our patient is laying comfortably. Can I get started, Dr. B?
Yes, you may.
So the first thing I'm going to do is put some numbing medicine under the skin. And sometimes patients don't like that. He may squirm a little bit, but he's doing pretty good. There it is. All right, if you have questions during this stream, feel free to ask. I'll be happy to answer them if I can. Again, I'm Dr. Deuk, CEO and founder of Deuk Spine Institute and pioneer behind the Deuk laser disc repair, Deuk plasma rhizotomy, Deuk piriformis release. All right, shot. I think I'm a little too low. I'm going to have to come a little more medial. The first step is placing a needle into the affected disc, or discs in this case. And shot. In this case, we're going to go for L5-S1. Thank you, Luis. So a little numbing medicine, please. We're going to place 4 needles to be exact because we have 4 areas that we're going to repair. A right and left at L4-5 and a right and left at L5-S1. Shot. We're heading down to L5-S1. Pretty big facets down there. Shot. Hopefully I can get in and fix that. Encountering the facets now. I may have to redirect to go a little bit more north. Shot. Yeah. Let me think for a moment. I need to go a little bit more lateral. I'm going to try a little more lateral here. If I can't get it, I'm going to have to start at a different location. Shot. All right, we're getting closer, which is a good sign. Shot. Might have it there. I was just telling my team that my son Arias, who's finished his first year at Princeton University, just graduated with straight A's. And he wants to become a doctor, like dear old dad, and practice medicine, AP, which is the best news you could all could ask for, because I can't live forever, and we're going to need somebody good to take over and help people get out of pain. I wouldn't trust just anybody. All right, shot L5-S1. You can see our needle is approaching that disc. Shot. All right. Not bad. Let's see if we can get in. Yeah, he's not going to like that. Shot. All right, let's get an AP. Can you feel that? Where did you feel it? In your back or your leg?
Where are you feeling that? In your back? Yes.
All right. We're still pretty lateral there.
You're doing great, my friend.
Yeah. All right, Jordan. We need to clean it up. I mean, to me, it doesn't look too bad, but I'm wondering if we can't make it a little bit better. You feel that in your back? I feel the disc. Let's see. Shot. I think that's a little bit, I don't know, better. What do you think, huh? Worse? All right. Well, he's not having pain down his leg. Nothing down your leg, correct? Huh?
Correct.
All right. This is the hardest to get into. Shot?
What are you feeling that? Your back?
What do you say?
It says he's feeling right where your heel pressure is, right where your hand is.
Shot? That's your bad disc, by the way, my friend. I think we're in. Shot. I think that's in, yeah. Let's just do a quick little discogram just to make sure we're in and not pushed to the side, because he does have a big facet. It seems to be interacting with my needle and pushing it to the side. Ready? Shot. That looks like disc. Give me an AP. Lay still. You're doing great. We're almost done.
I thought you were going to put that away.
Uh-huh. All right, stay there. That looks like disc. Shot? Yeah, that's disc. Okay, lateral. Knife. I'm going to make our first incision. You're doing great. Everything's going very well for you. We were able to get in at 5-1. Ray Tech, please. Uh-huh. Any questions from the audience, Henry? Shot?
At this moment, no current questions.
Let's show the audience, why do discs cause pain? Welcome. Now you understand why disc can be so painful. It's, where do you feel that?
Where are you feeling that, my friend?
All right, Sean. No problem. Should be better. You're okay. Everything's okay. That's why we have you awake to help us. All right. There's no doubt about it. Sean? At this point, we're trying to get into the discs that need to be fixed. And remember, he's had AP. He's had laminectomy in the past. I don't know if you guys could see that scar back there. Yep. That laminectomy is unfortunately a very destructive surgery. You're okay.
You're doing great.
Yeah, you're doing great.
Really well.
There's a lot of scar tissue from your surgery. That's what I'm dealing with, but we're going to get through it. I feel it. All right, that looks really good. If I can just get around that facet. You doing all right? How are you guys doing over there with the arm board?
No, we just have to readjust.
Uh-huh, that's fine. But do you need me to stop what I'm doing, or are you guys good? All right.
We fixed it.
We're just about finished here. AP. You're doing great, my friend. We're almost done. Uh-huh, lateral. Huh? Yeah, that's fine. We want him to be strong. All right, very good. Pressure there. So the first step in this surgery is to place these spinal needles not in the spine, but in the disc, which is, you know, part of the spine, I suppose. Shot? Very good. And remember, I'm fighting the scar tissue from his laminectomy. which we're going to get through. Shot. All right, perfect. I'm almost done with the last needle. Give me an AP. Perfect. Lateral. We did a discogram at 5-1 already, just because I wanted to make sure the needle on the left was actually in the disc. We've lost about maybe 3 cc's of blood. Are you okay? All right, we're going to put you to sleep in just a minute. All right, I just need your help for another minute, and we're going to put you to sleep. You're doing great. Shot. So I've got my needle in 4-5 on both sides. I've got a needle on the left at 5-1. I'm trying to get my right needle at 5-1. Shot. And there's just a lot of bone spur here. Jordan, show us the audience what we're talking about. Are you comfortable? Yeah. How long have you had back pain for? How many? 8? 18? What do you say? 30?
3 years.
How many? 3?
Years.
So, did it start before 3 years? It got worse 3 years ago, or you never had back pain before 3 years? Huh?
Before 3 years ago.
Yeah, that's what I thought. Everybody always says when it got worse. When did it first start? Your first time in your life?
10 years old.
You were 10 years old? 18. That's what I thought you said. So he was 18. How many years has he had back pain? You may break the new record. You may break the record.
So 53, 54 years.
Wow, he just broke the record, man. This has been a record-breaking week. 54 years of back pain, folks. He has had to adjust his lifestyle, basically watch out, not do anything strenuous because it's going to set off his back for 54 years. That's sad. All right, are you having any pain right now? You said no? All right, are you comfortable? How bad is that on a scale of 1 to 10?
9.
The highest it was 9? All right, L4-S1 was a 9/10. Was that where you get your back pain? All right, is it better now? Sorry about that. We had to test it. We found one of your bad discs, L4-S1, definitely causing your pain. We're going to fix it for you. Is it better? Yes?
Yes.
All right. How bad is that on a scale of 1 to 10? 10? Is that where you get your back pain? L4-5 is a 10/10, concordant. All right, great. We're going to go to sleep. When you wake up, surgery's over, okay? All right, good job. We found the 2 painful discs. That pain is going to be gone. So great news. Now he's traveled from Florida. Yeah. Count out loud from 1 to 100 so we can hear you. Count out loud. He's from Florida. About 80% of our patients now come from out of country, out of state. But we do get a good number of Florida patients who find us. He's had a laminectomy. Can you see that, Henry?
Yes, we can.
You could see a scar right here.
Yes.
I
Yes, we
didn't
can.
make that scar. Somebody else did. But I'll, trace it. Look at that thing. Okay? All that scar tissue, destruction of the spine, surgery, recovery, pain, and suffering for what? Nothing. Laminectomies don't work. They just don't work. All right, we're going to get started. Keep counting. You're doing good. That's just medicine going in your arm. Shot? Any questions? Shot?
Yes, we have a question from
Shot.
Johnny on YouTube
Hi, Johnny. Shot?
asking what makes the Deuk plasma rhizotomy different and why is the plasma rhizotomy different? I better also get the piriformis release also with major butt pain.
Are you seeing the guide wire? I'm
buttock
not seeing
pain.
Shot? Jordan, you see it? Should be 4-5, right, Louis?
These 4-5 should be.
Yeah. So, Johnny, great question. The problem is, shot, that rhizotomies today done by doctors are done with radiofrequency ablation generally, shot. And radiofrequency ablation, or RFA, shot, is a procedure, shot, where a little skinny needle, shot, okay, is about as big as this right here, it's tiny, is placed, shot, where the surgeon or pain management doctor believes, shot, that, oh, you see it in the, okay, I see it now, shot, there it is, shot, just to make sure, I want to make 100% sure, shot, all right. So the pain management doctor sticks this skinny little probe at your facet joint, SI joint, wherever it is, and then turns it on and heats it up with this generator that's, you know, like a $30,000 generator. It's ridiculous how expensive they are. They're not worth $30,000. They charge $30,000, but for the company does to buy it. So you got this generator that heats up the tip of the probe to about 80 degrees Celsius, and it does a burn, okay? But it burns about 5 millimeters around it. The problem is the nerve isn't there more than half the time. So it's not burning the pain nerve. It's just burning muscle, fat, sinew. Then, guess what? If it does burn the nerve just grows back. That's why these procedures either don't work or they don't last. So what I pioneered was a technique where I go in, and instead of just burning in one spot, I take a probe that can be moved and wanded, we call it wanding, and I burn it 10 times the energy that a RFA is, and I slice around till I cut the damn nerve. Okay? You're okay, lay still. Shot. Honestly, once I realized what was going on and why it wasn't working, it was like a, I don't want to say really simple, but it wasn't too difficult to figure out a way to make it permanent. Being a neurosurgeon and all, yeah, we're good. Our job is to usually protect nerves, but sometimes we have to cut nerves. And we know how to kill nerves. We know how to protect them. We know how to kill them. Pain management doctors don't. So really it took a neurosurgeon to figure it out. The problem is most neurosurgeons don't do pain management. They do brain tumors and other things, you know. They don't do pain management. They think back pain is a joke. They don't take it serious. They don't care about it. They send patients to the pain doctors. Pain doctors can't fix it because they don't know how to destroy a nerve properly. We do. So it was just the right person, right time, right situation. So that's the difference. Our Deuk plasma rhizotomy destroys pain nerves permanently, whereas the other treatments today don't. And that's why it works. We didn't discover a new pain nerve. It's the same pain nerves everybody knew about. And what I did was just figure out a way to kill them properly, rather than just stun them. If you remember the old Star Trek movies, you could set the phaser to stun or kill. And let's just say that everybody's been using the stun mode. I developed the kill mode. Kill technique. All right? That's really kind of, I'm just trying to make light of it, but at the same time, it's a serious solution to a serious problem. And honestly, to be honest with you, I really don't think the doctors want to fix people's pain. I don't think they want to cure it because they make a lot of money, people coming back getting repeat business. I mean, honestly, before I figured this out, I looked at our doctors' logs of RFA procedures on patients, and we would have sometimes patients coming back 15 times over years, 10 years, you know, getting RFAs. And I'm like, my God, why should anyone suffer this bad, this long, this ridiculous? And I figured out how to fix the problem permanently, and now people don't come back. So that's what it is. It's a permanent fix, and it works. It's not, you know, it might work and it might last. It will work and it will last. Hope that answers it for you. All right, Henry, have we shown any video?
We showed what causes back pain.
Let's show the audience why this surgery works, how it works. How does the Deuk laser disc repair work? And understand something, folks, a few things about this procedure. Number one, it's pretty much bloodless. We lose a few drops, that's it. Number two, it's outpatient, there's no hospital. This is like in and out, okay? In 4 hours, you're fixed. Number three, complications are extremely rare to have any complication from this procedure because it's very safe. And number four, it is the most effective treatment available in the world for back pain from a disc injury. Okay. The other option is fusion. And if I did a fusion on these two discs, this guy's pain would go away, just like it would with laser. But then there would be a big incision, there'd be bleeding, there'd be pain and suffering and muscle damage, soft tissue damage, complications, general anesthesia, pneumonia, all the bad stuff. Okay? So this is a much safer and better way to treat chronic back pain that comes from a disc problem. I will tell you this, the insurance companies in the United States don't want you to know about this procedure because they know once people know, they're all going to want it. So they try to keep it hush hush. All right, let's show them how this works. Grab her.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, so you can see from our video animation that a small incision is made, 7 millimeters, that I go in with a tube that's like a metal tube, which you can all see sticking out of the back here. And I bring an endoscope down to find the tear and herniation. I use a laser like I am now. That's the blue thing moving around to deliver energy, very powerful energy that basically transmits the waveform of energy into the tissue right here. This scar tissue, degenerated nuclear material. So the laser energy is transmitted from the glass tip into this tissue. And when it enters the tissue tries to contain it or transmit it, but it cannot transmit it. So it absorbs, the tissue absorbs the laser energy, and then it literally blows it apart. So it just explodes the tissue. It breaks all the covalent bonds holding proteins together, carbohydrates together, and just literally rips it apart. I know it's pretty graphic, but that is what happens. So that's how the tissue disappears, right? So the laser energy hits it right here. It's absorbed by the tissue, and then the tissue just vibrates and breaks apart. And it disintegrates into little pieces. You can't see it. And then it comes up in the water column. If I stop the water column, then you can see the pieces of tissue. Watch, we'll stop it, and now you can see it. You see it? All those pieces of tissue?
Yes, we do.
Okay, and now when we start the irrigation again, it washes it out. So it's important during the surgery. Look at that bone spur. That's a bone spur I actually have to remove because it's right on the nerve. You guys ask about bone spurs all the time. With Dr. Deuk, can you remove bone spurs? There you go. Easy peasy Japanesey. All right. Goodbye. Bone spurs are easy to remove. I usually don't remove them because they're not in the way, they're not causing problems. We leave them alone if they're not causing problems for the patient or me. If they block my way to the disc herniation, then I have to remove them. This one is literally underneath the nerve root, so I had to remove it. You holding the tube? Tube? Yeah, hold the tube. All right, good. You can feel my sneaker is starting to get wet. I got it? Huh? All right, thanks. All right, I will take the questions.
This next question coming from Abraham on YouTube.
Did I answer the last question? I don't remember.
I believe so, about Johnny asking what and why plasma rhizotomy is different.
Oh, sure. Yeah, Johnny, let's show Johnny our Deuk plasma rhizotomy procedure animation so he can understand what we do.
Copy that.
They say a picture is worth 1,000 words, and an animation is 1,000 pictures, so, well, maybe not 1,000, but a couple hundred. So, yeah, this is better than me talking through it.
Facet joint injury is a common cause of chronic back pain. Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
All right, great, Henry. So now we understand how facet joints cause back pain, but can you show us a video of how the DPR works?
Copy that.
Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right. Well, what do you think, Henry? You think they understand how the DPR works now?
I believe so.
Yeah. So basically, it's a minimally invasive procedure that uses energy from our plasma wand and delivers that energy to little nerves around the joints that are basically pain nerves, and it destroys the pain nerves to the joint. All right, let's take some more questions.
Next question coming from Abraham on YouTube. Asking, hello, Dr. Duke and team. After the DLDR is complete and the disc heals, would there be scar tissue at the site of the intervention?
Hi, Abraham. How are you? Thank you for saying hello. Is there scar tissue at the site of intervention? Great question. So, folks, what is scar tissue? Scar tissue is collagen. Collagen, spelled C-O-L-L-A-G-E-N, with a little bit of elastin, E-L-A-S-T-I-N. That's what scar tissue is. It turns out that this annulus that's torn is made from collagen and elastin. So, I don't know how you want to say it, but I would say no and yes. Complicated answer. Because what the disc is going to be healing with is collagen and elastin, which is annulus fibrosus, the same thing that was torn. But it is also scar tissue. You call it scar tissue. So it's not really scar tissue. It's just the annulus is repairing itself. And you know, it's interesting because there aren't many tissues in the body that when they repair themselves with collagen and elastin, they really isn't scar tissue because they are themselves. I don't know if that makes sense, Abraham. Hopefully it does. Thank you, Luis. All right, we are just about done. Another 30 seconds. You can see some fat at 12 o'clock. Some thickened ligaments, which I'm removing. It's called the foraminal ligament or ligamentum flavum. And then this herniation here. Just about done. Removed a lot of bone spur here. Okay, more than we normally do because normally we don't have much bone spur to remove. But in this patient we did. I feel pretty good. I'm going to show you in just a moment. Maybe we can see his nerve root. We're at L4-5, so it would be the L4 nerve root. All right, let's take a look. The nerve root, well, it's going to be in that fat right there. So good news, there's still fat around the nerve root. That's where the herniation was. That was the annular tear. The inside of this tube is 5.5 millimeters, so that's about a 3 millimeter tear. That's going to seal with collagen. We're done. Went very well here. We fixed one disc. We got 3 more to go. This just keeps turning. Any more questions?
Yes, we have a lot of questions. This next one coming from Jamie on YouTube.
Hi, Jamie. Welcome.
Asking, since pain is the way your body says there's something wrong, is getting rid of the pain permanently good?
Yeah, Jamie, great question. So we get that question from time to time. And, you know, pain is certainly a message from part of your body saying, hey, you got a problem here. That's great to know. However, when pain keeps people from doing their job, keeps people from, you know, relationships and living life to its fullest, and sports, athletics, hobbies, family, then it's really not good to have pain, is it? So that's the kind of pain that we want to get rid of. We're not getting rid of pain that's telling you there's a problem. We're getting rid of the pain that keeps you from having a life. We're getting rid of the pain that makes people put a gun to their head and pull the trigger. That's the pain we're getting rid of. So I think that's a good thing.
Orthopedic pain is so different from visceral pain. Now, if you have chest pain from a heart problem or
Yeah.
see from a lung problem, that's a different story. That pain has to be attended to.
Yeah, Dr. Berndes made the point that orthopedic pain, which is what you feel in your back that we're fixing, is different than, say, pain from your heart not getting enough oxygen or glucose. And so that's the kind of heart pain you want to feel. You want to feel like if you're having a heart attack. We're not taking that ability away. Sean? People can still feel their visceral pain. We're just getting rid of the sharp pain that interferes with life, makes life not worth living.
Like appendicitis pain can save
Yeah.
your life. You
Yeah.
have pain in your right lower body, if you go to the doctor, surgeon to get your
Yeah.
appendix out for first.
Yeah, Dr. Berndes is right. It's always good to know when there's pain, but when pain interferes, with you doing the things you need to do, being a parent, being a spouse, doing your job. It's disruptive. It's bad. It's pathological pain. That's what we get rid of, is pathological pain. I like that. Thank you for spurring the philosophical creativity. All right. Next question. Shot?
Next question coming from Rita on YouTube.
Rita. What a surprise. Rita never asks questions.
They asked, my pain doctor can only give
Shot?
shots to me, but now won't. I'm being given up on your idea of wealthy people setting accounts so people like I could come is a great idea. How we could ask them? Any ideas?
Yes. Yes, I do. Contact Mark Zuckerberg. Tell Mark Zuckerberg you need his help. Tell him to make a donation so you can get your surgery done. Same thing with Bill Gates. Same thing with, what's his name? Amazon. Jeff Bezos. Shoot, don't stop at them. There's lots of millionaires and billionaires out there that got way more money than they can ever do with. Talk to, what's the woman's name that founded the medical record system that's stolen billions of dollars from healthcare? Judy Faulkner. Shot? Yeah, she has that medical record system. I forgot what it's called. Anyway, hospitals have had to fork over hundreds of millions of dollars to buy that software instead of taking care of patients. I think Epic. It's called Epic. Yeah, talk to Judy Faulkner. Tell her that you need help. She thinks she's a billionaire, multi-billionaire now, because all the money that's been taken away from patient care and given to basically a software company, the monopoly. Yeah. Yep, there's a site called GoFundMe. I've never had to use it, thank God, but I know other people have. I would use GoFundMe. You know, there's a lot of opportunities out there. I would never tell you to, you know, go rob a liquor store or anything. Huh? Yeah. But, yeah, it makes me angry that people have to suffer needlessly when we can fix them. Yeah. I can't work with the towel on top of the pedal. Nothing makes me more angry than greedy people who have far more money than they need, and they've gotten it through ill-gotten gains by taking away from health care, through lying and deceit. You know, here's something to think about for a moment. United States was ranked #1 in the world in healthcare. This was 20 years ago. Now we're...
Like 5 or 6, right?
No, now we're in the 30s.
The 30s.
Of all the developed countries, we're down in the 30s. We're at the bottom. I guess it depends on whose list you check, but point is, the reason we're way down there now is because we've spent money not in taking care of patients, but on useless technology that is really there to enrich politicians and business people, bureaucrats. Okay? If you think about it, how many tens of billions of dollars have been spent on useless, unnecessary technologies in healthcare, like electronic medical record systems. The only reason electronic medical record systems are mandated by all doctors and hospitals is so that doctors will spend more time filling out the computer than they will seeing a patient. taking care of a patient, okay? Here's the thing. Before we had EMRs, doctors could see 50 patients a day and take care of all 50. Now, they can only see 10 or 15 a day because they got to spend the rest of the time filling out the computer. Now, the insurance companies won't pay you unless you fill out the computer. So you're forced to fill out the computer, and that's mandated by the insurance companies. The insurance companies are the ones who basically promoted the use of electronic medical record systems for two reasons. Number one, to slow doctors down and reduce the number of billable services they perform, which is office visits or procedures. And number two, so they could audit doctors very easily. And number three, so that they didn't have to do the work of data entry into the database to see whether or not they should be paying or not paying. Basically, they took their job, administrative work, and put it on the doctors and hospitals, which is data entry, okay? Then they also have been able to deny more and more claims to doctors and hospitals, making doctors and hospitals suffer financially. Many of them going out of business. I just showed you guys earlier this week that Stewart Healthcare, which is one of our nation's biggest hospital operators, is going bankrupt because they don't have enough money. Okay? Yeah, $9 billion in debt. A lot of that is EMR, electronic medical record money. They spent on EMRs instead of patient care or paying their bills for other things. Now, I made it a point to say that we used to be number one in the world in healthcare. Now I'm going to tell you something that's shocking. When we were number one in healthcare, there was no electronic medical record. There was a paper record. We used charts, paper charts. Okay? That's how we did it. We spent more time on patients than we did on paper. Now they're forcing us to spend time on computers. Most doctors report they spend 70% of their time filling out medical records on a computer now. Okay? It's horrible. They've put so many tasks and burdens that don't pay, so we're struggling financially, but also it reduces the amount of orders we do. If you could give an order before, give that patient medicine, and it took you literally 10 seconds, and now you got to log in, you got to find a computer, you got to log in, you got to open the chart electronically, you got to place the order. It literally takes 20 minutes to do a medication order right now. Okay? So patient's dying, give them this medicine. If you have to do it electronically, it takes 20 minutes. If you have to do it verbally over the phone, it literally takes 10 seconds. Right, Berndes?
I have a question. The doctor's texting right now.
Yeah.
I don't know if they can send the first patient.
Send them home. Send them home. Send them home.
Just want to double check.
Yeah, our first patient we did endoscopic laser on the cervical for 2 discs. He's already chomping at the bit to go home. So we're sending him home. He did great. He had the best anesthesiologist. Anyway, my point is, folks, these technologies have been put in place with electronic medical records to basically reduce the amount of health care being delivered to patients, not improve it. Now, of course, when the insurance companies lobbied for the EMRs, they didn't go out and say, this is going to slow down doctors and, reduce the amount of health care given. They knew it would, but they didn't say that. They said, oh, this is to improve health care. This is to make it better, safer. It's been proven over and over again, electronic medical records do not make our health care safer or better. Yet, nobody's taken them away. Okay, why am I telling you guys this? Because you need to know the truth. Number one, you need to know the truth. Number two, you need to do something about it. I can tell you right now, if we keep down this path, there will be no doctors that are independent. They'll all be controlled and owned by insurance companies. They will be telling you what the insurance company wants you to hear, which is, oh, you don't need that test. But doctor, I've got swollen lymph nodes all over my body. I think I have cancer. No, just go home and sleep it off. And if you get out of line as a doctor, if you have concern like, oh my God, you may have cancer, lymphoma, let's order some tests, the insurance company will fire you from that company. They'll fire you. And then you won't have a job, and you have to move. So doctors will all be afraid to actually do what's best for the patient And that's where we're headed. That's where we are now, by the way. We're already there. Doctors working in the hospitals, unlike me, I don't work in the hospital, they are having to get on that medical record system all the time to put orders in. And every time they try to order a test or something, the computer pops up, are you sure you want to order that test? There's no evidence showing that you should order that test. So people don't know this stuff. Doctors don't talk about it. I talk about it because people need to know, because it affects their care, their livelihood, their life. It doesn't affect me because I'm independent. I'm one of the few doctors who are actually independent. And what makes me independent? Our patients. Our patients give us the ability to be independent, to free think, to provide the best care for our patients. Because our patients actually, most of them pay out of pocket for their surgery. So I'm not beholden to an insurance company or a hospital. I can actually do what's best for the patient. And I always do what's best for the patient. Okay? Maybe I'm not perfect and I'm not 100%, pretty close, but I'm always going to recommend what's best for my patient. And that's because they're paying my bill, not the fucking insurance company. So, next question.
Next question coming from, I apologize, I can't pronounce the name. We're just going to go with Cap on YouTube.
Calf, welcome.
Cap, like the baseball cap,
All right, Cap.
saying, is it possible to stabilize your disc injury without surgery? Because I can't get help. It's mentally breaking.
Depends on the kind of injury, Cap. Cap, why don't you do a free MRI review with me? I don't charge. He's moving. You know, all you got to do is send us your MRI, either by mail or a login credentials, and there's a form you fill out online. Henry will put a link. If you do that, I'll look at your MRI. I'll tell you what's wrong, and at least you'll know what's wrong. And then you can ask me that question, because I can't answer it right now because I really don't know. I don't know your situation, unfortunately. Let me know when I can go. So do the MRI review, but let's say that you have this problem right here. Is there any way to stabilize this without surgery? The answer is no. There really isn't. Berndes, can I go or wait? Yep. Yeah, unfortunately, this is it, surgery. It's either the laser or fusion. That's the only two surgeries in the world that fix this problem, disc problem. You know, pain from a disc, laser that we're doing right now, or fusion. That's it. Trust me, I've looked at everything. Nothing else works. Nothing else works consistently. Next question.
Next question coming from Rita, once more on YouTube,
Hello, Rita.
asking, if it did get approved
Right.
all over and only you do, I think they're talking about the DLDR. If it did get approved all over and you do what you do, or what would happen? You would need to teach to many then on how to do it like you. Then you would be busy to do it with your patients. God bless you. We need you.
Yeah, thanks, Rita. Yeah, I think scaling up is okay. It's not hard. What I would do, I've already got a plan to scale up. I would find the best surgeons in the world, the ones that are intelligent, capable, compassionate, driven, want to be the best, and I would take 10 of them. I would train those 10, and then they would train 10 more themselves, and then those 10 would train 10. You know, and there would be exponential growth in this knowledge acquisition, sharing. So I'm not worried about that. That's doable. The problem is reimbursement. The problem is getting money for these procedures, because unfortunately, and I'm a little different because I'm in a nice situation where I don't need to be paid, but we do need to cover the cost of surgery. Other surgeons want to make a living, so they're going to want money. Now, the good surgeons, you know, they need about $600,000 a year. Why? Because if you don't give them $600,000 a year, somebody else will. And if somebody else does, well, they're not gonna be here, are they? So that's just the reality, right? It's like, you know, we pay these NBA basketball players $10 million a year. Why shouldn't we pay a neurosurgeon $600,000 a year? It's wrong not to. You know, neurosurgeons go through a lot more than an NBA basketball player does. A neurosurgeon goes through all the medical school, and they have to be at the top of their class if they're good. So they have to study day and night for 4 years. They have to, by the way, to get to med school, which means they got to study day and night for college for 4 years. And by the way, to get to a good college, they had to study day and night and 4 years in high school. And then they have to do 7 years of neurosurgery, which is 110 hours a week. So why should an NBA basketball player, football player be paid, you know, $2 million or more a year when surgeons are paid far less, doctors are paid far less? So we've got to be able to pay the good surgeons appropriately to do this procedure. And the insurance companies are making sure that doesn't happen. They don't want people doing this procedure. They don't want to pay for it. They know it works. So we got to fight the insurance companies to get fair payment. We've got to fight our competition, which wants to hire neurosurgeons to do fusions. And we got to get them reprogrammed to do less invasive treatment. Okay? Almost done here, about 30 seconds, Dr. B. I just got to get a little bit more. No, we're at the painful part. No doubt about it. Yeah, no doubt about it. All right, let's take some more questions.
Next question coming from Diamond Hodlings on YouTube. Asking,
All right, Diamond.
asking, do you have any offices here in New York? And if so, do you accept workers' comp insurance?
Yeah, we do accept work comp. Unfortunately, New York has now changed the work comp laws where they make it very difficult to get money after we do surgery. So we do take work comp. We used to take New York work comp patients all the time because New York work comp would pay. But New York is tired of paying your bills. They don't want to pay for you guys anymore. So they've created something called a portal in work comp where we have to log in, and then what they do is they basically just put you in a portal, which is quite interesting, where they make you go to the portal and just they make you go in like endless loops of computer data entry, which they never end up approving the surgery, you know? And you spend all hours and hours trying to figure out what the portal wants from you and never get anything approved, which is they basically send you out to the desert to get lost and die. That's what the portal for New York work comp is. It's criminal. It never should have been allowed, but there's a lot of corrupt politicians and they're influenced by the insurance company. You know who pays the bill, right, for work comp? It's an insurance company. So what the insurance companies in New York did, they got together and they said, let's make this portal thing mandatory and we'll make it so confusing nobody will ever figure it out. And that way, if you want to get a surgery approved for a patient, you have to go to the portal and get it approved. But it's impossible, right, to navigate the portal. It's like me putting you in the middle of the Sahara Desert and say, find your way home. And it's like doctors' offices just give up. You know, you got a $15 an hour person trying to figure out something that needs Albert Einstein squared to figure out. These are the kind of games the insurance companies play, and people don't know about it. So anyway, we do take New York work comp, but they're going to have to basically prepay for your surgery. We've gotten them to do that once or twice. It's worth a try. I would do the telemed free MRI review, get a recommendation, and then let us talk to your work comp adjuster. Okay? That's my best advice. Shot? All right. There was another part to that question. I don't remember what it was.
The other part, it's just asking if any offices were here, if we had any offices.
No offices in New York. Sorry. We're in Florida. We're a small company, by the way. We've just discovered something very big. So we should be a big company, but we're not, because I won't sell out to venture capitalists. Okay. Venture capitalists, when they buy you out, they want big returns. That means you got to do something to make more money. Well, what they usually do is they'll have you to do unnecessary treatments for patients, which I won't do. They'll have you, squeeze more money out of patients, which I won't do. So we don't have a lot of offices. We only have one. And it's because we do what's right. Okay? All right. Just about done. We got 2 more discs to go. I felt this thing go through that tear so easy. That means there's a big tear over here. Big tear in the back of the disc. Yeah, it's worth coming to Deuk Spine in Florida. You don't want to go anywhere in New York. New York's got some really good surgeons if you want fusion, right? And they'll just recommend fusion for you. But you don't want to be fused. Lots of problems with fusion. More questions?
Next question coming from Rita, once more on YouTube.
Hi, Rita.
Saying, I'm about to see a neurosurgeon my neurologist sent since I have something also in head growing. I asked if he can look at my back, hip, knee too. Said no, just head. He said I'm their only Takayasu patient.
Yeah. So, first of all, Rita, thanks for sharing, but it doesn't surprise me the neurosurgeon won't check your hip and knee because that's orthopedic. But you're right. They should send you to an orthopedic to help you, right? A good doctor will try to help you. But yeah, he's focused, or he or she is just focused on your brain issue, and they're not going to work on your back. Like I said before, most neurosurgeons don't treat back pain. They don't know how to. So they don't even offer treatment. That's why we broadcast, folks. We want you all to know there's hope here at Deuk Spine to get fixed. You just got to get here and get it done. We'll do the rest. I know that's hard for most people, but it's the best we can do today. Get here and we'll get you fixed.
We have a couple more questions.
Sure.
This next one coming from Ping on Facebook.
Yes, Ping.
Saying, morning doc, I did a nerve conduction study test with needles at the wrist and elbow, which came back normal, but still abnormal at the deltoid. Do you think cubital tunnel is still likely the cause of my elbow, forearm, and hand discomfort? The nerve test said I didn't have carpal tunnel, but my median nerve in my wrist was 16.5 millimeters and considered severe in both hands. I will get the free MRI review for the neck ASAP. Thanks again.
Yeah, so great. Thanks for sharing. I didn't really catch that. You said the nerve test was normal or not normal?
They said, yeah, the nerve test said I didn't have carpal tunnel, but my median nerve wrist in my wrist was 16.5 millimeters and considered severe in both hands.
Yeah, I don't know. Great question. Usually 5 meters per second, slower than 5, and the median nerve is what we look for. So something doesn't add up. Yeah, I would have my nerve test doctor look at your test, if you were here, and get his opinion. Dr. Damola or Dr. Patel. Dr. Patel is board certified in electrophysiology, so he could analyze that test and tell us what's going on. I'm not really board certified in it. I don't do those tests. I just look at the results that the other doctors tell me, but something doesn't sound right. All right, we are in the right L4-5. Look at this torn annulus. This is an annular tear, and I'm cleaning it with a laser because it's not going to heal unless I do this. You got to get rid of all this stuff right here that's stuck in there. But you can see the tear on both sides, right? If you don't rewind, you can see it. The tear, middle of the tear is right here where my laser is. There's another piece of torn annulus. You see how it's golden color? That means there's lots of inflammation in the tear. And over time, inflammation creates calcium deposits. That's the calcium deposit, okay? So I've got to clean the tear. It's called an annular debridement. That's what I'm doing with the laser. Remember, this tube is about 5.5 millimeters wide internal diameter. So from that right side to the left side, it's 5.5 millimeters. The laser fiberglass part, 1 millimeter, just to give you a perspective of the size of things here that we're working on. They're very small, and 1 millimeter normally is very hard to see, but we're able to see it because of the endoscope. Okay. Next question.
Next question coming from Derek on YouTube,
Yep.
saying, I have a question. I had disc replacement at C6 and C7 3 years ago. Now I have pain, in pain again. What should I do?
Yeah, Derek, what you should do, the best advice I can give you is see me. I will see you for free. I'll see you online. You don't have to come here. Just get your MRI to us, the new one, and let me review it and do a Zoom call. Okay, why do you want to do that? Because I will tell you what's wrong. Okay, other doctors will not be able to do that. I will tell you what's wrong. They won't be able to do it because most doctors don't know what causes neck pain, but we do. Okay, we know how to figure it out. Once we figure it out, I'll tell you what you need to have done. Now, you don't have to come here to me and get it done. You can go anywhere. The only time you need to come here is if you want laser surgery, or if you want the best surgery, then you come here. But if there's another surgery you can do that you need to do at home, I'll tell you. So you get a free consultation is what I'm saying. And you're going to get answers to your questions. I just can't do it based on, this conversation because I have to see your MRI. I got to examine you. I got to see where your pain's coming from. People who do the free MRI review at Deuk Spine, they all get basically the same type of treatment, which is they get a physical exam. I examine you on that Zoom. I look at your MRI with you. So we literally go over together. I'll show you everything on it. And then I answer your questions, okay? But I first give you a diagnosis. What's wrong? How to fix it. It's really, really valuable. And you get it for free. I do it as a free service. I don't even charge people. I literally spend 2 days a week doing free work for people, volunteer work. Why? Because I want people to know what's wrong and I want them to know how to get it fixed. Because I don't think any human being should suffer needlessly. Because I know how debilitating this problem is, and I know how it ruins lives. And I don't want people's lives ruined by pain when it's so easy to fix. Okay? That's why. So I don't benefit anything. You benefit from the meeting. I do it as kind of a charity work, basically. Maybe it's the wrong thing to say, but it's true. We don't get anything out of it except satisfaction, knowing that we're helping people get better, hopefully. A lot of people think that invasive spine surgeries like laminectomy or fusion is the answer to their problem, but it's not. Many times it's the problem itself. You see, surgeries like that create new problems for patients, complications especially. When you do invasive surgery, you can have all kinds of complications. So people go into these surgeries thinking and hoping they're going to be out of pain from a fusion. But they end up waking up with a new problem they didn't have before. And sometimes those problems aren't fixable. They're permanent. And I just want people to avoid having a permanent problem they don't need to have. We're done here. Berndes? Yeah, we're at the painful part, and he's responding. So I'm almost done, like 30 seconds, and we're going to move on to the last disc that needs to be repaired. All right, I think I see something that's worth mentioning. Let me see here. All right, look at that. That is quite fascinating, folks. You see that white thing there? That's a nerve.
So we do.
That is a pain nerve, actually. It's called the sinovertebral nerve. And I have to admit, I have never seen it like that before. Never seen it like that good before. That is the nerve that brings pain to this area. That's why when I'm hitting it, he's complaining. Look at that. Yeah, you want to destroy that nerve. That's not a good nerve. That's the pain nerve. Wow, fascinating. Yeah. Yeah, when I hit it with a laser just there, he literally moved on the bed. That's how painful it was. He woke up. All right, good. So I think we got everything we needed to. That nerve is there. It's big because he's got a lot of inflammation. How many years? 54 years of back pain from this disc. So what happens is the scar tissue gets bigger over time in this area, and the pain nerves get bigger. Why? Because, well, they're trying to tell the person, hey, you got a problem here. So your body actually makes more of them in the area where you're having the pain. That's fascinating. That was pretty damn cool, huh? Last disc, yeah, yeah. Patient's doing good. He's asleep. He's going to go home basically an hour after the surgery. All right. Nice, Jordan. I love how you just knocked me out of the way.
Sorry,
No, no. I asked you to do it, so it's my fault. I got it. All right. Any questions?
Yes, we have a couple more questions. This next one coming from Rita once more on YouTube.
All right, Rita. You're on fire. You got a lot of questions. That's good.
Asking, I sent your name to someone in Europe and told them you do free MRI reviews. Do they have to send you the actual DVD? I said, I think you can help. They were told replacement, but also not sure what's wrong. They are in massive pain, barely can walk, so I said to get to you.
Yeah, great question. So to answer your question, we must see the actual MRI. All right, I cannot diagnose somebody based on a report. I must see the MRI. And the report is helpful, but more important than the report is the actual images. So yes, we must have either a login portal where we can go somewhere and find them, pull them down, so where we can use them and implement them in our packs, or I need an MRI CD, or they may be able to sweep their DICOM images into a file or Google Drive, and we can do it that way. So there's 3 ways, but basically I need the images. Yep, 100% need the images. I do need to see the images. The images won't tell you where pain comes from. The patient does, but I still need to see the images. All right, last one. Now our next patient, she comes from California? Maybe? No. Where is she from? Anybody know? She's out of state. No. Is she?
Yeah. West Coast.
Oh, West Coast?
Correct. West Coast.
Is that it there? All right. So our next patient is from the West Coast of Florida. Today is a Florida day. Yeah, he doesn't like this. Raytech. I got that. Trying to get down to the disc herniation. Need to get a little bit further on the guide wire and then we're good. Take that. Let me just feel it. Shot. That looks pretty damn good. I think I could live with that. Go. You're not happy with me right now. And moving around, making my life hard. We're in.
Is there syringes? Okay. Doesn't work well. Very inconsistent. Okay. It's hard for me to get a good plane in this position.
Huh? What? I already said yes. I said yes 10 minutes ago.
I sent you a message. I sent you.
Huh.
Sorry.
Yeah, no, I don't know. That's fine. All right. Nobody likes the hammering. I'm sorry we have to hammer. Did I answer the last question?
Yes, you did.
All right. Let's take the next question.
Next question coming from Lanu on once more on YouTube,
You can go out. Hi, Lanu.
asking your margin is very tight due to high payroll. Can you reduce your 75-person staff?
I can. Everybody, you're fired. Get out of here. I'm kidding, Lanu. I can't. Very thoughtful of you. Luis, will you take a pay cut? No, you're fired. Liz, will you take a pay cut? You're fired. I'm kidding. I'm glad you asked, right? No, unfortunately, I cannot. I've tried. We try to run a tight ship, we call it, but the reality is that I need all these people. Like I said, the insurance companies require all these people to be here. Otherwise, we would never get paid anything. So, we also need people for patient care. But you're right, we could have a lot less people if it was just patient care. If it was just patient care, I could have at least less than half the staff I have now. I could probably have probably around 20 people, 25. The other 50 people are literally related to the insurance companies and trying to get paid. And that's true for lots of places. I'm not the only one, you know. It's really hard to do all the documentation, prior authorization, insurance verification, billing, collecting, denials, medical documentation to support. I mean, there's so much that goes into getting paid. And yeah, the insurance companies know that if they make it very hard to get paid, that doctors won't hire the staff, won't do the things they need to do. 5 minutes, 5 minutes. As you draw up a huge syringe of propofol.
No, just going for the next picture.
Oh, okay. Yeah, 5 minutes. I'm impressed. Oh, Piri. Sorry, I forgot about the Piri. Yes, we're doing a piriformis next. All right, let's take one or two more questions. We'll end the broadcast and we'll go on to the piriformis.
This next question coming from Diamond Hotlings once more on YouTube,
Hi, Diamond Hot Links.
saying, okay, great, thanks. If approved, I could travel to Florida. I'll work on getting the surgery approved for my foraminal and lateral recess stenosis. I don't want fusion neither. I also have carpal tunnel, veins in my right wrist, and 3 tears in my left shoulder from all the operating the
Sorry to hear that.
MTA New York City bus. It beat me up pretty bad.
Yeah, sorry about that. I can do a carpal tunnel surgery, no problem. As a neurosurgeon, we're trained to do that. Happy to do it for you if you're my patient. Normally, I don't go out of my way to do carpal tunnels, but I don't mind doing it. I do a very good carpal tunnel surgery. And I know there's a lot of bad surgeons out there that don't do a good carpal tunnel surgery. So if you're my patient, I want you to have the best. I would do it for you. Okay? All right, just about done. This was not a bad one on this side. There is some right here I want to get rid of, and then we're done. About 2 minutes, and then we're done with the disc. I'll move on to the piriformis. And it'll take one more question, and then we'll have to end the stream.
Copy that. This next, last but not least, coming from Rita once more on YouTube, asking if I can somehow get a new MRI here, since my back, hip, and knees are in pain do you review all of that at once? And the charity is beautiful, thank you.
Yeah, Rita, thank you. We don't. We only do one body part at a time. It just gets to be too onerous because so many people have more than one problem. And I could never get through the MRI reviews for everybody if I had to do every body part, okay? So it's just one at a time. All right, folks, we're done. We're gonna end the broadcast. We're gonna come back on a piriformis, okay? We've done 4 discs, 4 areas, 2 discs. 4 disc herniations. I need to suck this out first.